You've been trying to get pregnant, but then you find that you have fibroids. Now you are scared. You have questions like, can fibroids stop pregnancy? Does fibroids cause miscarriage? And why is it that some women with fibroids get pregnant easily while others struggle to conceive? In this video, I'm going to be using this diagram to show you how fibroids can affect pregnancy. Now, this is a diagram showing the female reproductive organs. This is the vagina. It receives the penis during intercourse. This is the cervix. It is the mouth of the uterus. It opens slightly during period to allow menstrual blood flow through, and it opens fully during labor to allow the birth of the baby. This is the uterine cavity. It is the uterus. This is where the growing baby develops during pregnancy. These are the fallopian tubes, while these are the ovaries. The ovaries stores egg in a woman's body. Now, before I show you how fibroids affect pregnancy, let me quickly show you the normal process of how pregnancy happens. Now, for pregnancy to occur, the sperm must meet the egg. Now, during intercourse, the penis deposits semen into the vagina. So this is the vagina. So the penis deposits semen into the vagina. That semen contains millions of sperm cells. So these are the sperm cells. Now, these sperm cells migrate or swim into the uterine cavity through the cervix. And they swim towards the fallopian tubes. Now, for an egg to be released, ovulation must occur. Ovulation is the release of a matured egg from the ovary. So let's say ovulation happened on this side of the ovary, and this red dot is our egg. The egg has been released from the ovary. Now, the fallopian tube receives the egg. The egg enters the fallopian tube and stops somewhere here. Then the sperm cells continue to swim towards it. So the fastest sperm swims towards it and fertilizes the egg. Now, after fertilization, the fertilized egg becomes a zygote. So now, over the next 5 to 6 days, the zygote migrates into the uterus and attaches to the lining of the uterus. That process of attaching to the lining of the uterus is called implantation. So let's say this is our fertilized egg implanting here on the wall of the uterus. So now, after implantation happens, pregnancy is said to have occurred. Now, you can see that the process of getting pregnant is straightforward. So how does fibroid affect pregnancy? First of all, fibroids are benign growths arising from the muscle of the uterus. They are not cancer. They don't spread to other parts of the body. A lot of women have fibroids. Some don't even know they have fibroids. And a lot of women with fibroids go on to have successful pregnancies without complications. So, when you have fibroids or when you are told you have fibroid, the first question you should ask is, what is the size and location of the fibroid? Because not all fibroids affect pregnancy. So now, if the fibroid is located on the outer wall of the uterus, that is, if the fibroid is located here, it is called a subserous fibroid. If the fibroid is located on the inner wall of the uterus, it is called a submucous fibroid. So if the fibroid is located on the inner wall of the uterus, it is called a submucous fibroid. Now, if the fibroid is located within the muzzle of the uterus, these shaded parts are the muscles of the uterus. If the fibroid is located inside within the muzzle of the uterus, here, within the muzzle of the uterus, it is called intramural fibroid. While if it is located around the cervix, it is called a cervical fibroid. So these are the locations of fibroid. Outside wall of the uterus is subserous fibroid, inner wall of the uterus is submucous fibroid, within the muzzle of the uterus an intramural fibroid, and in the cervix it is called a cervical fibroid. Now, if the fibroid is located on the outer wall of the uterus, it does not affect fertility because it is located on the outside. However, those fibroids can grow so large and they can press on the bladder to cause frequent urination or press on the rectum to cause constipation. However, they do not affect fertility. They do not affect getting pregnant. Now, we have the submucous fibroid. These are the fibroids that we are worried about because sometimes they affect getting pregnant. And I said sometimes because it is not always. And I'm going to show you the various ways they can affect pregnancy. Number one is they can affect implantation. Remember, I said that after fertilization, this zygote moves over 5 to 6 days to come and implant on the wall of the inner lining of the uterus. Now, let's say the zygote has come. Instead of implanting here that it implanted, it decides and wants to come and implant here that we have our submucous fibroid. It won't be able to implant because there is already a fibroid there, and that can cause implantation failure and pregnancy won't happen. But look, there is a lot of space inside the uterus. So it can implant somewhere else, here, 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 and pregnancy will still happen. So how it affects implantation is if the zygote wants to implant in a position or in a location that already has a fibroid there. Another way these submucous fibroids can affect pregnancy is if they block the fallopian tube. Let me give you an example. So now you can see that we have a large submucous fibroid blocking the entrance into the fallopian tube. So even if the sperm cell comes and an egg was released here, you can see that the sperm cells will not be able to enter the fallopian tube to come and fertilize the egg because the fibroid grew too big and it blocked the entrance into the fallopian tube. So that is how it can prevent pregnancy. But then look, we have two fallopian tubes. So even though this one is blocked, once the egg is released on this side, the sperm cells can still come, fertilize it, and once implantation happens successfully, pregnancy can still happen. Now, there is another way submucous fibroid can still affect pregnancy. Now, research has shown that sometimes during pregnancy, pregnancy hormones can make fibroids grow bigger. They can make fibroids grow larger. So, for example, we had a successful implantation here, and then our baby is growing. So it is growing, growing, and the pregnancy hormone is making this fibroid grow bigger. So it is growing. It will get to a point where there will be no space. So that can lead to something called intrauterine fetal growth restriction, meaning that the baby cannot grow, and that can lead to death of the baby. So that is another way submucous fibroids can affect pregnancy. But remember, I said sometimes, not all the times. It is not all the times pregnancy hormones cause the fibroids to grow bigger. Sometimes it can happen, other times it won't happen. And that is why when a woman is pregnant with submucous fibroids, they are monitored more frequently than other women without fibroids. So if other women are coming for antenatal care visits 2 times in a month, she might be asked to come weekly. So now, those are the ways submucous fibroids can affect pregnancy. Now, we have intramural fibroid. This is the fibroid growing within the muzzle of the uterus. Now, usually these do not affect pregnancy. They do not disturb pregnancy. However, sometimes they can grow so big, especially when the size is greater than 6 centimeters. So when it grows this large, it distorts the shape of the uterus. And when it does that, it can also reduce the space inside the womb available for pregnancy to develop. And that sometimes can lead to pregnancy loss. Now we have cervical fibroids. These are very rare, but when they occur, sometimes they can grow very large. They can grow so big that they block the cervix. So they block the entire space here. So the sperm cannot even enter the uterus. And when the sperm cannot enter the uterus, cannot get to the fallopian tube, cannot meet the egg, pregnancy will not be able to happen. However, like I said, this happens on rare occasions. So now you can see how fibroids affect pregnancy. And you can also see that even though fibroids affect pregnancy, pregnancy can still happen even with fibroids. I hope you learned something from this video. And if you did, please like the video and drop your comments in the comment section. In my next video, I'll be showing you how sexually transmitted infections can affect pregnancy. I will see you in that video. Until next time, stay healthy and be kind to yourself.